They sound like a great deal. Travel to a foreign country for a cosmetic surgery at a fraction of the cost that you'd pay here at home. But complications from botched procedures abroad actually cost the U.S. healthcare system an estimated $1.3 billion a year. Dr. Ralph Bashioum with Bashioum Cosmetic Surgery is here to tell us more about this trend and what you need to know before you go under the knife. Welcome. It's good to have you here today.
Good to be here.
Help define what medical tourism is and what kinds of procedures do people go off and get?
Well, medical tourism can be looked at in two ways. One is countries that have limited medical care. People that live there will travel to countries with more expertise in a certain area. So people from Saudi Arabia, the Middle East have frequently come to the Mayo Clinic for care, and they've been very successful at that. But then there's another trend of people in developed countries going to other countries, developed, undeveloped countries, for procedures at a lower cost. So that's another kind. And then a third kind really is where physicians go and provide medical care at some place.
For cosmetic surgery, what are the types of things people
go for? Well, the things that they're going for tummy tucks, facelift, breast enlargement, liposuction, and things like that because of the fees.
What are complications that can develop, and what makes this dangerous in some instances?
You know, any surgery that we do has complications. You scratch your skin and you have a complication. Sure. So the risk of infection, bleeding, scarring, other kinds of things. And there's social complications too, in that you may not get informed consent, you may be cultural differences, language differences, where you just don't understand exactly what's going on. And
you can get into trouble quickly, and then and where's that help then that would support you?
An infection can cost $18,000 to try to sort out once you get back to America.
Sure. What should you ask when you go in for a consultation? I think good doctors like lots of questions. What do you like hearing from prospective patients?
Well, I like to hear them ask all the questions that are appropriate. I like them to be informed, maybe multiple consults. Are important to see. It's nice if you're going to choose a surgeon to really see live results, because if you see, photos can be doctored, and unfortunately, not everybody can be trusted, particularly when you get offshore. So if you can see live results, that's important. You want to interview some people, and many people say, well, you should find somebody who you like. You're not trying to find a friend. You're trying to find somebody who's going to give you good surgery with a low reoperation rate.
How do you, doctors, set realistic expectations, especially when you're working on a face?
Yeah. Well, I think you have to talk about what can be expected, how much of improvement. You can turn the clock back when you do facelift surgery and things like that, but you're not going to turn it back 20 years, 10 years, 15 years, something like that, and that's what people need to know.
Well, this has been instructive today. Thank you for being here today.
You're welcome.
Appreciate it. You're going to find additional information at KARE11.com. Look under the 4 p.m. show page. Well, up next,